we've got Dominic Townsend, who's president of ABS Quality Evaluation, and he is of an certification association that's really important. And then Art Kurland, who is the Director of Capital and Asset Management at University Health, the largest employer in Bexar County around San Antonio, Texas. And Art has presented to a auditors group association and another association. I forget what the other one. So we're really spreading out across associations, and ABS Quality Evaluation is a patron member, has been a strong supporter. So thank you very much. Dominic, you want to go ahead?
Thank you, Mike. Just a quick background. I am Dominic Townsend, president of ABS Quality Evaluations. I get to lead a group of wonderful individuals around the world as a business assurance provider, certifying organizations towards management system standards. I sit on the ALM board, hopefully contributing to building the market awareness and the value of asset management. You know, as I look at all the standards that we offer, asset management really provides a lot of value in the communities that we serve around the world. So it's really exciting, some of the activities that we're doing. And as we were putting the agenda together for this meeting, one of the things that we wanted to highlight was a client that's certified. And one that quickly came to mind was University Health and the leadership that Arthur Kurland has done with the University Health, really driving the asset management activities within the hospital. And they were one of the early providers of certification within the healthcare community, if not the first. And Art, I think you launched your activities back in 2016, achieving certification in November of 2017. And their mission is all about providing quality healthcare within the community that they serve, which really drives those type of partnerships that we like to partner with as organizations, because they're leaders in their communities. And we talked a lot about Industry 4.0 today, but however, Industry 5.0 has been launched. And Art, I don't know if you know this, but it's all about focus of people working with robots and smart machines, which brings me to a story. When I first met Art, when I walked into the hospital back in 2016, I see all these robots on the floor bringing medical supplies or packages to all the rooms. And you're a pioneer of Industry 5.0 and starter. And I don't know if you realize it, but that's what it's all about. And when I think about the hospital, it's just been an exciting journey for us, as well as partnering with Art and what they've done in their community. So just a great job, and we're proud to be part of you. And with that, you know, I like to highlight Arthur's certification for ISO 55000. He's going for his recertification next year, but he's expanded the certification during the last year, and we're excited to be part of that, and like to offer this certificate, and congratulations, Art.
Thank you, Dominic.
Here, let's try to play.
Okay.
Let's do that. You got one more. Look at their smiles.
Art, this is your chance to be a movie star now.
Yeah. Thank you, Dominic. Well, I too am honored to be here as well, for a couple of reasons. First of all, just to talk about personal property in asset management. I think it's something that's often forgotten. And two, just being invited by ABS and Dominic. I don't know if you know, but American Bureau of Shipping it's an organization that's been around over 150 years. They're in, I think, over 20 countries worldwide, have like 6,000 clients. And from what I understand, when ABS was invited here to speak. Mike said, you know, why don't you invite one of your clients? And so being chosen out of that pool, it's really, I couldn't miss it. I had to be here, yeah, even coming from another conference just last week. So thank you. I have control of the slides, I'm thinking. Ah, okay. Thank you.
That might be the magic device.
Okay, thank you so much. There's another device up here. But, okay. So just a little bit about University Health. We've been around over 100 years. The legal name is Bear County Hospital District. We are in part maybe 20% funded by taxpayers. Also, just forward-thinking organization, blessed to have leaders that just want to be out in front, trailblazers, and it kind of made our journey to certification a little bit easier because, you know, in a hospital environment, certification is just goes with the territory. I don't know if you're familiar with like Joint Commission, things like that. So certification is just part of the culture. And so when I approached senior leadership about becoming certified in our asset management, it was very well received. I approached the chief financial officer, and of course, the first question out of his mouth was, how much is this going to cost? So, and I was equipped with that information. I knew we had already sent out, you know, requests for proposals and whatnot. And so I told him, and also explained the benefits that we can get from it. And verbatim, he said, you know, it sounds like we don't have much to lose. So I got the green light to go forward with that. Also, and Mike can attest to this, I'm very passionate about personal property. I could probably spend like 10 hours talking straight about personal property, but Mike said, all right, you got 10 minutes. So I'm going to try to just condense 10 hours worth of material into 10 minutes, which means I'm going to talk really fast. So a little bit more about University Health. We're the largest public health care system in Texas with over $3 billion in assets. Again, part of our funding is through the taxpayer, but it's just a small part of our funding, over $2 billion in revenues and close to $2 billion in expenses, which is perfect because we're a not-for-profit organization. We have a 2 million square foot main hospital in San Antonio. San Antonio is, I believe, 6th or 7th largest city in the country. Pretty soon, we'll probably surpass Phoenix and Philadelphia to be number 5, according to the Census Bureau. More people moved to San Antonio metro area last year than any other place in the country. And we're prepared for that. Our leadership is purchasing property throughout the area to build future hospitals. So again, blessed to be in an organization with forward-thinking people in charge. We also have, by the way, as a hospital district, we have not only the main hospital, but we have 2 outpatient surgical centers in Bear County, plus about 20 clinics throughout the county, as well as a couple of business centers, data center, warehouse, other facilities. And our certification covers all of that in terms of our personal property asset management. We have currently under construction. This is an artist's renditioning of the future Women and Children's Hospital. It looks a lot like that now. It's going to open by this time next summer. It's a $600 million project, $400 million in the structure, and $120 million budgeted for furniture, fixtures, and equipment. To Jim's opening comments earlier about spending on furniture, fixtures, and equipment, likely to outcost the structure, the building hopefully is going to last 50 years. And this, I'll just call it stuff inside, is going to probably be replaced even just 5 times a refresh. And so now we're talking $600 million in furniture, fixtures, and equipment versus the initial cost of the building of 400. So personal property is very important. And speaking about the robots, I had to throw that picture in, or I would have been disinvited. So yeah. So these are automatic guided vehicles. They're there when the trucks are backed up to our dock. They're already pre-programmed RFID to take supplies from our medical suppliers to the floors. And they're so good that they'll even bring the empty boxes back down to be disposed of when they're finished. So they're very polite. They'll let you know when they're coming, and they'll let you know when they're turning. And so they don't complain, and they work 24/7 for free.
It's like being on a set of Star Wars. Really, they're going beep, 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 and talking to you. It's really cool.
Yep.
I have to make, they also have a operating. So when they have to get fixed, they have this room where they're working.
Yeah, that's where they get programmed every day and are instructed on what floor to go to. And they all have names. They have little stickers with their name on them. So that brings me to the main subject, why it matters. Well, most organizations with employees have a couple of things in common. They have the people, which generally represents the highest cost in terms of salary and wages. And then they have the property, which is generally the second highest cost that an organization will incur. And that property is broken down into a couple of pieces, with real property being the structures and everything affixed to the structure, and the personal property or the stuff. And as we've already established, that cost can exceed the real property. And so a lot of organizations think, well, I have an IT department, they're managing the computer equipment, or there's a biomedical engineering department, they're managing the medical equipment, and all the departments are supposed to be managing their furniture and fixtures and whatnot. But you're relying on that when that's not really their primary job. I mean, a lot of as far as like hospitals are concerned, they leave the asset management part of it, of the personal property, to their materials management department, when their priority is to get supplies to the clinical floors. And the asset management part of it usually, is not a priority for them. And that's generally the case in all these departments where, the computer, as long as it works, they're happy. Same with the medical equipment. But there's no transparency to the senior leadership level to let them know what these things are doing. So for example, with human resources, you have broken down into, let's call them just sub-departments. Like you'll have recruiting, and you'll have your benefits, and you'll have your learning and things like that, but they're all covered by human resources to communicate with leadership. And the same thing with your facilities or your structures. You have those sub-departments where you'll have your electrical people, and your plumbing, and your HVAC, and your painters and things like that. But they're all covered by the facilities department, who's charged with communicating that to senior leadership. And so I say that the personal property part of it goes undermanaged. Again, it's being managed by individual departments, but not as well as it could or should be. And to Jim's point earlier, they may be around the corner. I don't know, the Census Bureau. This comes right from their website, that spending on equipment is greater than it is on structures. And Jim and I guess will explain why. That's is because of the refresh of the personal property just happens a lot sooner than the structures. So just some of the things that we've been able to show our senior leadership by managing our personal property. And that first one really is in a hospital setting is the most important thing to a hospital administrator. And we save clinical staff time because before there was an asset management department at the hospital, the clinical people would have to do things by on their own, or just spend time trying to figure out who the right person would be to call for a particular issue. And so we've been able to eliminate that by creating our department. And a lot of these things occur kind of out of necessity in terms of like, how do we know how much time we're saving? Because when I heard the hospital administrator say, that's the most important thing you guys do, I went back and I said, I want to find out exactly how much time we save. And so we've put that ability to measure that as part of our processes. We've been able to reutilize assets that aren't, that one department may not need. It goes through an assessment. If it's good enough to use somewhere else, we make that available through our intranet. And so it's kind of like a shopping cart where a department might need, for example, a desk. They can go on the company intranet and just see pictures of what's available and select them, add it to the cart, and we go ahead and deliver that. And if it can't be reused within the organization, we'll put it up for auction. If it can't be auctioned, we'll try to recycle it. And we've partnered with recycling companies as well. In a hospital, space is a premium. We've been able to manage our space much more efficiently. And we've also created an asset management advocate program. And that's kind of like, it works kind of like the safety advocates in a large organization where, the fire alarm goes off and everybody finds their advocate and they follow them to a particular place for safety. So our advocate program is basically the eyes and the ears of the organization. Again, we got like 10,000 people spread out across 1,200 square miles. And so we have an advocate representing over 300 departments. And so those are the people we communicate with to get information, to ask for input. If they see something, they say something. And that's worked out really, really well for us. The participation rate is exceeded my expectation. So I wanted to put this up here because, like me, a lot of people might say to themselves, I'm just going to get my hands on the ISO standards, and I'm just going to follow them and do what they call a self-certification, and kind of say to themselves, okay, we're doing everything the standard says we're supposed to be doing. And that's kind of like letting the referee play the game. Yeah, so when we were going forward with our gap analysis, and I was so proud of the strategic asset management plan I had put together and everything, and then ABS came in and just kind of shook their head and so, you are so far from a certification audit, you have no idea. And so that just really opened my eyes, and it's really helpful and beneficial to see and hear the experiences of an organization like ABS Group to come in and share their knowledge, and from what went from a 2-page strategic asset management plan ended up a 32-page asset management plan before they said, okay, now you're ready for your observation audit. So how much time I got left? If there are any questions? Okay.
So the first time I heard Art tell his story, it was I was just delighted because my favorite part of the story was the amount of time saved. And the way he framed that the first time I heard it was when nurses go to set up like the operating room, instead of having to kind of wonder where the stuff is, they know exactly where it is because, it's because now they care about it. And, you've got the asset management department focusing on this. So things are needed, things that are needed are available when they're needed and where they're needed. And so it translates into mission performance, frankly. And that's one of the things that some of y'all know that Jim accuses me of going down rabbit holes. And one of the rabbit holes I've been down is basically going across, reading about all the different organizations around the world that have been listed on the known certified organizations list. And that's acquainted me with a whole lot of certificates. And one of the things that most of y'all, that unless you've done this exercise, you might not know, and that is that the scopes of the asset management systems for most certified organizations are around personal property. So when people think about property that is mission critical, in the real world, the mission critical property is most often personal property. Now those of y'all who spend time in the federal government might not realize this, because within the federal government, everybody seems to care mostly about real property. We have a real property council. We don't have a personal property council. So there's been this emphasis in the federal government about real property, largely because there's so much of it and it's so expensive. But in terms of what's mission critical, unless you're the Forest Service, what's mission critical. I mean, I don't want to say that, because obviously facilities are mission critical too, but personal property is what usually arises to the top of what organizations consider mission critical.
It's the tools that the people need to do their jobs. Yeah. And just let me say, oh, I'm sorry. Go ahead. I was just going to expand on that, but so when I first got to University of Health, I used to park near the dock and just, to avoid all the traffic to get into the hospital, which is huge. And I used to come into the dock, and every morning there'd be just more stuff on the dock. Every day I'd come in, more desks, file cabinets, patient monitors, just piling up. And one day I stopped to the dock manager. I'm like, what's going on with this stuff? Where's it coming from? And, he goes up and, oh, they're bringing it down during the middle of the night. And I have no space here. And so, yeah, that's some of the time they were using their time, instead of focusing on patients, to just transporting this, broken stuff or down and clogging up the dock. So,
and what Jennifer said, it's where the rubber hits the road. That is literally on the ground. So that's really important. David?
So bear with me. This might be an interesting question, but in honor of our systems of systems, and many times I become the voice of inanimate objects, of pipes and valves and things of that nature. But so I'm kind of curious, in the systems of systems and property management, so the patients, I'm assuming the hospital considers patients as one of their stakeholders. But from a personal property, and again, this is a little twisted, but have you looked at like the humans as, and I know they're people and hopes and dreams and all that, but they're also, they are interacting with your stuff. Do you look at like them and how maybe personal property is degraded over time, and the usage and the patients, just the coming and the going? And is there any analytics on, just the human aspects of these bodies coming and going, and what it means to your personal property management?
There is, again, for example, the biomedical engineering department, which handles all the medical equipment, they have their own committee to do those types of analytics. And they are part of our asset management governance committee. So in a hospital, the personal property is generally 30% computer related equipment, 30% medical equipment, 30% furniture fixtures, and then the other 10% is miscellaneous, kitchen equipment, environmental services equipment, vehicles, stuff like that. So we have a asset management governance committee where those stakeholders are part of, and we have these types of discussions, and those metrics are presented, and senior leadership is involved with that.
Thank you. Jim?
So I spoke, as Art referenced a little bit at the beginning, a little bit about personal property and having my eyes opened. And I had the opportunity to be on the other side of this in a recent meeting. And I'll say, it wasn't anybody in this room, but I was in a meeting with other asset management professionals, a virtual meeting. And the topic of personal property came up. And we're talking about it a little bit. And one of the people says, what's personal property? And other people, that were infrastructure asset management people said the same thing. What's personal property? And I was like, wow, I'm blown away. I mean, first, it's in the dictionary, like you could just kind of look it up. But if you could be in asset management and not have awareness of personal property, whether it's your primary focus or not, but maybe a bridge doesn't have any personal property, but every facility has personal property associated with it. And as we pointed out, often a huge amount. To me, the trick is you have to think about it in big pieces to get people's attention. So in Art's example, maybe, if you talk about all the IT equipment, well, that's a number that starts to get people's attention. But if Art's comments haven't done anything today except make infrastructure asset management people, more aware of the import of personal property, I think he's done us a great service. So.
And we do have our facilities department looking now at what we do and how we do it. And they're taking an interest also in following the 55,000 path.
Before we thank Art, we would like to hear from Jennifer.
I just cut you. This is just a point of curiosity. I'm wondering if you have looked at, or if it's even possible to track any relationship between the administrative outcomes from asset management and the clinical outcomes in your hospital.
No, haven't. Right now, the only metric we're keeping is, like I said, how much time we're saving the clinical staff. That's a very good point to look into doing something like that. And getting all the information regarding personal property generally just leads to questions like that, and then other metrics to try to look for. So it's really interesting that
I just think that could be really powerful to draw a line between better asset management, better outcomes for the staff, better outcomes for your patients. It could be a fascinating case study.
Well, before we thank Art, I would like to talk about the ripple effect that he is creating. So certification was achieved, and then all of a sudden, the real property people came over to his office and said, or the facilities people said, hey, what's this ISO 55,000 thing? And so he's starting to teach them. Then the IT people came over and said, hey, what's this ISO? So he is expanding the circle even in his organization. And it just shows us, what Jim said, how much room we have to help. Yeah. So thank you so much, Art.
thanks for having me.